Hello, good morning everyone. I'm Dr. Suresh, consultant psychiatrist. Today is World Sleep Day. I would discuss the normal sleep rhythm, abnormalities in sleep pattern, and sleep hygiene. Sleep is an important biological event that is necessary for all the individuals in the universe. Sleep is being maintained by a neurochemical that is melatonin, which affects the sleep wake cycle. The sleep is also being influenced by other neurotransmitters like dopamine, serotonin, GABA, etc. A normal individual would sleep between 6 to 8 hours. However, in children of less than 1 year would sleep 16 to 20 hours in a day, and the child between 5 to 6 years would sleep 14 to 16 hours in a day. And in elderly, the pattern would change. Of more than 60 years, the sleep pattern would be between 4 to 6 hours in a day. However, it is important to know the sleep patterns in an individual, which will be allowed to keep an individual alert, to concentrate, and to memorize, and to keep more alert in an individual. Let us see the common causes of sleep disturbance. Commonly, we tend to encounter the people who have been addicted to various substances like alcohol, nicotine, cannabis, and caffeine tend to present to us with lot of sleep disturbances. And also the various mental illnesses like depression, anxiety, severe mental illnesses can also affect the sleep pattern. Among medical illnesses, obstructive sleep apnea, diabetes can also cause sleep disturbances. And number of neurological disorders are also affects the sleep. Normally, many a times we tend to encounter elderly population that is of more than 60 years tend to present to us with insomnia, that is difficulty in falling asleep, for the treatment. So here it is very important to address the concern by various methods. Sometimes it requires medications, and sometimes it also include the sleep hygiene practices which needs to be followed by all the individuals who have been suffering from insomnia. Apart from addressing the major psychiatric or mental illnesses of like depression and anxiety. Apart from the medical treatment aspects for sleep disturbance, it's always better to follow a good sleep hygiene. Number one, the person should use bed only for sleep instead of using sofa or divana which is at home. Second would be minimize or avoid using gadgets during night times because it emits blue rays which will induce photoreceptors which is present in the eyes and keeps the person awake. At home, in the room, the curtains should be closed so that it can minimize the light entering through the windows during night times. Avoid using coffee or tea after 6 p.m. because these are the stimulators which can induce the brain and make the person more alert. Avoid having a heavy meal during night times. Even if you have, at least have a brief walk so that you will not be having abdominal discomfort, which can also affect the sleep. Avoid any kind of distractors in the room, like using a clock which makes some noise, and try to drink a glass of milk before going to bed. An individual should follow a principle that if he is not getting sleep, even after 20 minutes of going to bed, he should get out of the bed and try to read some book or paper which is more boring so that within some time he may fall asleep. So, sleep can be a more worrisome, hence, so seek a help at a right time so that you can have a pleasant sleep, which can also induce your good physical health as well. Thank you.